Hello guys, could anybody able to guess the disease on seeing picture? You can see it is dryness of mouth, xerostomia, and deep furrows in the tongue. And it is second clue is it is autoimmune disease. Yes, it is Sjögren's. It is a it is a prototype for coming to disease. It is a prototype of autoimmune disease characterized by lymphocytic infiltration of exocrine glands resulting in xerostomia. Coming to pathogenesis, it is mainly affected by endogenous and exogenous factors. Endogenous means it is overexpression of nucleic acid. Exogenous means hormonal factors and viruses. Why only exocrine glands like parotid gland, submandibular gland? It is due to cells of ductal and acinar cells are overexpressed by these factors like viruses and hormones leads to activation of these cells and marginal centers of the respective glands. Coming to the pathogens, intracellular autoantigens like Rho and La on their cell surface are activated. These are the specific features, 5 to 10% of the Sjögren disease affected persons are in further 10 to 15 years. These anti-Rho and anti-La and autoantibodies are raised. You can see, and this is also character features of extragranular manifestation of the disease. This is the after the of the after this activation, this produce pro-inflammatory cytokines and lymphocyte attracts chemokines. In the body, pro-inflammatory cytokines are activated. Due to this, apoptotic bodies like toll-like receptors 379 are activated, and ICAM and CD40s are activated, and finally B cell activated factors is activated. You can see in mostly major salivary glands are infiltrated by B cell, and minor salivary glands are infiltrated by T cell. This is the character features on histopathology examination, as I told in German center. Coming to clinical features, dryness of eyes. I can do in Schirmer test. Normally Schirmer test less than 10 within 5 minutes is the normal value for as a hyperacusis. If there is hyperacusis, there is greater than 10 if this dryness of eyes, it is less than 5 which is character feature of Sjögren's. And dryness of mouth means principal oral symptoms, xerostomia. Diagnostic test means cyanometry and MRI, major salivary gland. You can see the in MRI, germinal centers are activated. You can see the B cells and T cells. Could anybody able to tell the criteria for diagnosing Sjögren's? You can see the criteria here. Histopath showing focal lymphocytic cell adeninitis with a focus score greater than 1 bar 4 millimeter square. It is the character. It is the highest score. Both presence of anti-Rho, anti-La, antibodies and histopathic examination are the highest score. And ocular staining with Lisman green, and another rose Bengal stain is also there, which is also the helpful in producing staining. This gives score 1, and Schirmer states less than 5 within 5 minutes, at least one eye. It is have score 1. Unstimulated whole salivary flow of less than 0.1 ml per minute. It has score of 1. If primary Sjögren's, at least one symptoms of ocular and oral dryness means, or total score of greater than 4 from given criteria leads to primary Sjögren's.